Good afternoon. Our study is a comparison between lubricant eye drops, the 2020 rule, and their combination in management of digital eye strain. Digital eye strain refers to visual disturbance and/or ocular discomfort related to the use of digital devices. It is seen in up to 90% of digital device users at some time. The symptoms include ocular surface related symptoms such as irritation and burning of the eyes and dry eyes, asthenopic symptoms such as blurring for near or distance vision and difficulty refocusing from one distance to another, and also extraocular symptoms such as musculoskeletal pain. The aim of our study was to evaluate and compare the effectiveness of three types of interventions in alleviating digital eye strain symptoms. These were lubricant eye drops, the 2020 rule, and a combined approach utilizing both of these. The study was a prospective interventional study, and data was collected from 54 IT professionals aged between 20 to 35 years regarding their symptoms on the starting day using a questionnaire. The inclusion criteria was individuals using screens for more than 8 hours per day, aged 20 to 35 years, and who reported any symptoms of digital eye strain, and those who are unwilling to follow the 2020 rule or use the lubricants, those who are already using contact lenses or have undergone refractive surgery or with uncorrected refractive errors, and those already on lubricant treatment, as well as those with significant ocular pathology with corrected vision less than 6/9 were excluded. The questionnaire was given as follows, and data was collected regarding the symptoms which the participant was experiencing as well as the frequency of the symptoms. And participants who reported symptoms were randomly assigned to one of the three intervention groups. Symptom severity was assessed before and after the intervention period using the questionnaire, and a comparative analysis was conducted to determine the relative efficacy of each approach in symptom reduction. The participants in the lubricant group and the combination group were advised to use the lubricant which was provided, which was carboxymethyl cellulose 0.5% 4 times a day. And the participants in the 2020 group and the combination group were advised regarding the procedure of the exercise, which was to take a break from the screen every 20 minutes for 20 seconds and look at something 20 feet away. The results showed that the most common symptom was eye strain or fatigue, followed by watering. And p-values were obtained as follows, with the most improvement in total digital eye strain score in the combination group. The lubricant group was found to be very effective at reducing ocular surface related symptoms, and the asthenopic symptoms showed a trend towards improvement in this group but did not reach statistical significance. The 2020 rule group showed more improvement for the asthenopic symptoms than the ocular surface symptoms, and there was no significant improvement for double vision or headache. The combination group showed significant reduction in both groups of symptoms, with the best improvement in eye strain, dryness, and blurred vision, and only headache showed no meaningful improvement in this group. The discussion study was on 54 patients for 4 weeks using all three interventions. Study by Girish Mishra on the efficacy of lubricants in digital eye strain showed that 44.2% of patients with less than 8 hours screen use and 34.9% of patients with more than 8 hours of screen use had improvement. And the study by Talens Esterels et al. Also on the efficacy of the 2020 rule also showed that digital eye strain symptoms reduced with the rule, but ocular surface parameters remain constant. In conclusion, both lubricants and the 2020 rule are valuable in the management of digital eye strain, and a combination of both would be the most effective management. These are my references. Thank you.
We know computer vision syndrome needs both lubricants as well as taking breaks and all that stuff. Why do you want to subject trial for? It has been tried, right? So why this? I mean, why such kind of a design? Is it correct to put the subject the patient to this when we know what has to be done?
And most of the time, when patients report symptoms like this not in the hospital setting, like at camps and all, they're usually advised to do the 20 exercise mostly. So giving lubricants also would be more helpful for them.
Well, we should be giving them lubricants. One way, apart from ocular surface driving or takes care of, when they apply the brake, that's all. I mean, when they apply the drop, that's also a brake. So when we know these are the benefits, somehow this design I'm not convinced.
Let me play devil's advocate here. That what she is claiming, there may be some surgeons who simply give lubricant, don't advise the 20-20-20 rule, right? For computer vision syndrome. So you want to guide them. Okay, this is nice, but you remember one thing: when you're planning a study, this standard rule, you cannot deprive a patient of the standard of care. Okay, so this study is good for a small kind of study, but when you go to publication, then they will ask this question: ki, how could you deprive the standard of care to the patient? So that thing you'll have to keep in your mind.